Hi there, I'm Maya, and you'll meet my daughter Emily in just a few moments. We both use DUPIXENT, dupilumab, just like you. And just like you, our doctor showed us how to inject it, but we all need a refresher every once in a while. So we're going to show you how to properly inject a dose of DUPIXENT. Whether you're administering the injection to yourself or injecting a loved one, will be an additional guide for your at-home experience. I know injections can be intimidating. To be honest, we were both pretty nervous when we first learned that we'd be doing the injections ourselves at home. But with a little patience, practice, and a few support calls to our doctor, and DUPIXENT My Way, we've gotten better at the process and are excited to share that with you.
When I heard DUPIXENT was an injection, I was concerned on how I would handle injections and doing it myself.
Over time, I've definitely gotten more used to taking DUPIXENT. It's a part of my life, just like going to the doctor.
At first, my daughter Jolie wasn't thrilled at the idea of receiving an injectable medication. So we sat down and we talked about it and we weighed our options. Jolie thought about it and she said, "You know what, Mommy? I really want to try DUPIXENT. Let's move forward."
So we follow 3 basic steps for either self-injecting or giving an injection to someone. I'll give you the important details later in this video. But here are the basics. 1. Gather your materials. You'll need things like your DUPIXENT pre-filled pen, an alcohol wipe, a cotton ball or gauze, and your sharps disposal container. 2. Prep. This includes cleaning the injection site really well with the alcohol wipe. And 3. Inject and dispose of the single-dose pre-filled pen. In my opinion, this could be the most intimidating part of the injection process. But don't worry, we're here for you. Before we do any of that though, it's important to read the instructions for use located in your DUPIXENT treatment packaging. If you haven't read it yet, pause the video and take a look. You'll want to read through the full instructions for use carefully before using the pre-filled pen. The steps for injecting yourself with the DUPIXENT single-dose pre-filled pen are the same for the 200 mg and 300 mg dosage strengths, except for the warming time, which will be described in more detail later. In this video, I'll be injecting myself with the 300 mg pen. I'll also show you how I give an injection to Emily using the 200 mg pen. If you have any questions about the dosage prescribed, please contact your healthcare provider. Let's take a closer look at the pre-filled pen. I found it helpful to familiarize myself with the different parts of the pre-filled pen, like the cap, the window, and the needle cover, before handling the pre-filled pen itself. Contact your healthcare provider or DUPIXENT My Way with questions. They're always there to help.
I was really blown away by how much support the DUPIXENT My Way team provides. You feel that they are in this with you and they're there to help.
It's time to take our DUPIXENT injection.
I'm ready.
Feel free to watch us. First, let's take the medication out of the refrigerator. Keep the pre-filled pen and all medicines out of the reach of children. Keep unused pre-filled pens in the original carton and store in the refrigerator between 36 degrees to 46 degrees Fahrenheit, 2 degrees to 8 degrees Celsius. Next, let's remove the DUPIXENT instructions for use from the packaging. You'll want to read this completely before using the pre-filled pen. I like to keep it open and nearby when injecting for reference. Done reading? Good. Now let's take one pen out of the packaging by holding the middle of the pen body so we can check the label to ensure that the medication and dosage strengths are correct and the expiration date has not passed. If either of those aren't right, contact your pharmacy. Do not inject DUPIXENT if the expiration date or dosage strength are incorrect. Okay, now let's take a look at the medicine through the viewing window. The liquid inside should be clear and colorless to pale yellow. If you see an air bubble, that's okay. An air bubble is totally normal. A few important disclaimers about the medicine and the DUPIXENT pre-fill pen. Do not inject DUPIXENT if the liquid is discolored or cloudy, or contains visible flakes or particles. Do not use the pre-filled pen if the window is solid yellow. Do not use the pre-filled pen if it has been damaged. Do not use the pre-filled pen if the cap is missing or not securely attached. If you have any questions about whether the pen is okay to use, please call DUPIXENT My Way or your healthcare provider. If you have an unused pre-filled pen, return it to the refrigerator in the original carton to protect it from light. Step 1. Let's gather our materials. We'll keep those instructions for use nearby and then lay the pre-filled pen on a flat surface and let it naturally warm at a room temperature of less than 77 degrees Fahrenheit, 25 degrees Celsius. Do not store DUPIXENT pre-fill pens at room temperatures more than 77 degrees Fahrenheit, 25 degrees Celsius. Do not keep DUPIXENT at room temperature, less than or equal to 77 degrees Fahrenheit, 25 degrees Celsius for more than 14 days. After removing a DUPIXENT pre-filled pen from the refrigerator, it must be used within 14 days or thrown away, disposed of. The recommended warming time for the 200 milligram pen is 30 minutes, and for the 300 milligram pen, it's 45 minutes. Here's a few more helpful tips about the DUPIXENT pre-filled pen. Do not freeze or heat the pre-filled pen. Do not put the pre-filled pen into direct sunlight. Do not shake the pre-filled pen at any time. As the pen warms up, we can gather the additional materials needed to inject. You'll need a cotton ball or gauze in case there's any bleeding, an alcohol wipe to clean the injection area, and a puncture-resistant sharps disposal container to properly dispose of the pre-filled pen after it is used. If you don't have a sharps disposal container, call a DUPIXENT My Way representative to request a complimentary one. And don't worry, it's okay if your sharps disposal container looks a little different than mine. Looks like we're just about ready to inject DUPIXENT. So first, let's wash our hands thoroughly with soap and water. Now, take your supplies to an area where you can sit comfortably.
I like to do my self-injection in the evening in a quiet part of the house where I can focus.
So next, we need to choose an injection site. Both the stomach and thigh are acceptable, except for the 5 centimeters or 2 inches around your belly button. When I give the injection to my daughter Emily, it's okay to inject into the outer area of the upper arm. However, that injection site is only okay because I'm giving the injection to her, not if I'm injecting myself. Oh, and don't forget to choose a different site each time you inject DUPIXENT. That's important. Do not inject through clothes. Do not inject into skin that is tender, damaged, has bruises or scars, or into areas with visible veins. Here we go. Step 2. Prep the injection area. Clean the skin with the alcohol wipe. Wipe in a circular motion, moving from the outside to the inside. Do not touch the injection site again or blow on it before the injection. Let your skin dry before injection. Okay, are you ready for this? Next step is the actual injection. You've got this.
I prefer self-injection just because I feel like it's more controlled when I do it.
My husband went with me to the doctor so that we could both be trained on the proper way to inject it. And I'm just really proud that I could do it because I never thought that I would be a person that could do an injection.
Step 3, the injection. Pick up the pen by holding the middle of the pen body with the needle pointing away from you. With your other hand, pull the cap straight off. Once you have removed the cap, do not put it back on. Do not twist the cap off. Do not remove the cap until you are ready to inject. Do not press or touch the needle cover with your fingers. Do not try to put the cap back on once you have removed it. Now place the needle cover on the skin at approximately a 90-degree angle. Make sure you can see the injection window. You'll want to watch the window turn yellow as you give the injection. Take a deep breath. Press down and hold the pen firmly against the skin until you can no longer see the needle cover. It disappears up into the pen itself. When you hear a click, you know the injection has begun. It can take up to 15 seconds in total. As you hold the pen firmly, all the way down against your skin, the injector window will start to turn yellow. Make sure you watch that window turn completely yellow. You will hear a second click. After the window has turned completely yellow, keep the pen pressed against your skin as you count to 5 to ensure you are getting a full dose of DUPIXENT. After that, you can lift the pen straight up off the skin. That's it. The injection's over. You did it! If the window doesn't turn completely yellow, or if it looks like medicine is still coming out of the pen, you may not have received a full dose. Throw away, dispose of the pen, and reach out to your healthcare provider right away. Do not give yourself a second dose without speaking to your healthcare provider. Lightly press a cotton ball or gauze on the injection site if you see any blood. I rarely do, but I always keep an eye out for it. If you are bleeding, you could always cover the site with a bandage. And if the bleeding doesn't stop, contact your healthcare provider. Do not rub your skin after the injection. Here's where that sharps disposal container comes into play. Be sure to put the used pen and its cap into your puncture-resistant sharps disposal container right away after use. Do not reuse the pre-filled pen. Do not dispose of pre-filled pens in your household trash. Do not recycle your used puncture-resistant container. Keep your sharps disposal container out of the reach of children. Okay, that was my injection. Now let's show you how I give my daughter Emily an injection of DUPIXENT under the skin.
I prefer assisted injection because I get a little squeamish around needles. I don't want to look at it. I don't want to touch it. That's just not something I'm comfortable with, so I'd rather have somebody else do that.
I feel like one day I will do it myself, but I think right now assisted injection is better.
I prefer the comfort of our living room couch, but Emily likes to receive her injections in the playroom. To be honest, I do too. She can play a game or read a book while I give her the injection. We've already gathered our materials, let the DUPIXENT pre-fill pen warm at room temperature, and washed our hands. Let's find a comfy spot in the playroom to inject. I'm going to inject into Emily's arm this time, but last time I injected into her thigh. Next time, I'll inject into her other arm. It's important to mix up the injection sites. Always choose a different site each time you inject DUPIXENT. Do not inject through clothes. Do not inject into skin that is tender, damaged, has bruises or scars, or into areas with visible veins. If you're not comfortable with giving an injection to someone, you could always ask your child's school nurse to help out. Before I was ready, Nurse Maggie administered the injections according to the dosing regimen prescribed by Emily's doctor for an entire school year.
Laura's dermatologist trained us on how to do the injection under the skin, and then when we contacted DUPIXENT My Way, they sent a nurse to the house to give additional training to make sure that we were comfortable giving the injection.
Now, let's clean the area with the alcohol wipe. Do not touch the site or blow on it before the injection. I'll let Emily's skin dry before I inject her. Pick up the pen by holding the middle of the pen body with the needle pointing away from you. With your other hand, pull the cap straight off. Once you have removed the cap, do not put it back on. Do not twist the cap off. Do not remove the cap until you are ready to inject. Do not press or touch the needle cover with your fingers. Do not try to put the cap back on once you have removed it. Now place the needle cover on the skin at approximately a 90-degree angle. Make sure you can see the injection window. You'll want to watch the window turn yellow as you give the injection. Take a deep breath, Emily. You've got this. Press down and hold the pen firmly against the skin until you can no longer see the needle cover. It disappears up into the pen itself. When you hear a click, you know the injection has begun. It can take up to 15 seconds in total. As you hold the pen firmly, all the way down against the skin, the injector window will start to turn yellow. Make sure you watch that window turn completely yellow. After you have heard a second click and the window has turned completely yellow, keep the pen pressed against the skin and slowly count to 5. This helps to ensure you are giving a full dose of DUPIXENT. After that, you can lift the pen straight up off the skin. That's it. The injection's over. You did it! Remember, if the window does not turn completely yellow, or if it looks like medicine is still coming out of the pen, you may not have received a full dose. Dispose of, throw away the pen, and contact your healthcare provider right away. Do not give a second dose without speaking to your healthcare provider. Lightly press a cotton ball or gauze on the injection site if you see any blood. If you are bleeding, you could always cover the site with a bandage. And if the bleeding doesn't stop, contact your healthcare provider. Do not rub the skin after the injection. Be sure to put the used pen and its cap into your puncture-resistant sharps disposal container right away after use. Do not reuse the pre-filled pen. Do not dispose of pre-filled pens in your household trash. Do not recycle your used puncture-resistant container. Keep your sharps disposal container out of the reach of children. Follow your local guidelines and ask your healthcare provider for the appropriate way to dispose of the container once it is full. And don't forget to keep track of your injection date and site. We've got a weekly planner that helps us keep track. Others use digital calendars or whiteboards. Whatever helps you remember to take your DUPIXENT injection.
I write DUPIXENT on my calendar at home and in my pocket calendar to help me remember when to take it. I've got my self-injection routine down. I'm comfortable with it.
Thank you for joining us today. Remember, you can re-watch this video as often as you like to refresh your memory. Contact your healthcare provider or DUPIXENT My Way with questions. Important safety information and indications. Do not use if you are allergic to dupilumab or to any of the ingredients in DUPIXENT. Before using DUPIXENT, tell your healthcare provider about all your medical conditions, including if you have eye problems, have a parasitic helminth infection, are scheduled to receive any vaccinations. You should not receive a live vaccine right before and during treatment with DUPIXENT. Are pregnant or plan to become pregnant. It is not known whether DUPIXENT will harm your unborn baby. A pregnancy registry for women who take DUPIXENT during pregnancy collects information about the health of you and your baby. To enroll or get more information, call 1-877-311-8972 or go to https://mothertobaby.org/ongoing-study/DUPIXENT/. Are breastfeeding or plan to breastfeed. It is not known whether DUPIXENT passes into your breast milk. Tell your healthcare provider about all the medicines you take, including prescription and over-the-counter medicines, vitamins, and herbal supplements. Especially tell your healthcare provider if you are taking oral, topical, or inhaled corticosteroid medicines, have asthma and use an asthma medicine, or have atopic dermatitis or chronic rhinosinusitis with nasal polyposis, and also have asthma. Do not change or stop your corticosteroid medicine or other asthma medicine without talking to your healthcare provider. This may cause other symptoms that were controlled by the corticosteroid medicine or other asthma medicine to come back. DUPIXENT can cause serious side effects, including allergic reactions. DUPIXENT can cause allergic reactions that can sometimes be severe. Stop using DUPIXENT and tell your healthcare provider or get emergency help right away if you get any of the following signs or symptoms: breathing problems or wheezing, swelling of the face, lips, mouth, tongue, or throat, fainting, dizziness, feeling lightheaded, fast pulse, fever, hives, joint pain, general ill feeling, itching, skin rash, swollen lymph nodes, nausea or vomiting, or cramps in your stomach area. Eye problems. Tell your healthcare provider if you have any new or worsening eye problems, including eye pain or changes in vision, such as blurred vision. Your healthcare provider may send you to an ophthalmologist for an exam if needed. Inflammation of your blood vessels. Rarely, this can happen in people with asthma who receive DUPIXENT. This may happen in people who also take a steroid medicine by mouth that is being stopped or the dose is being lowered. It is not known whether this is caused by DUPIXENT. Tell your healthcare provider right away if you have rash, chest pain, worsening shortness of breath, a feeling of pins and needles or numbness of your arms or legs, or persistent fever, joint aches and pain. Some people who use DUPIXENT have had trouble walking or moving due to their joint symptoms, and in some cases needed to be hospitalized. Tell your healthcare provider about any new or worsening joint symptoms. Your healthcare provider may stop DUPIXENT if you develop joint symptoms. The most common side effects include atopic dermatitis, injection site reactions, eye and eyelid inflammation, including redness, swelling, and itching, sometimes with blurred vision, and cold sores in your mouth or on your lips. Asthma, injection site reactions, pain in the throat, oropharyngeal pain, high count of a certain white blood cell, eosinophilia, and parasitic helminth infections. Chronic rhinosinusitis with nasal polyposis, injection site reactions, eye and eyelid inflammation, including redness, swelling, and itching, sometimes with blurred vision, high count of a certain white blood cell, eosinophilia, trouble sleeping, insomnia, toothache, gastritis, and joint pain, arthralgia. Tell your healthcare provider if you have any side effect that bothers you or that does not go away. These are not all the possible side effects of DUPIXENT. Call your doctor for medical advice about side effects. You are encouraged to report negative side effects of prescription drugs to the FDA. Visit www.fda.gov/medwatch or call 1-800-FDA-1088. Use DUPIXENT exactly as prescribed by your healthcare provider. It's an injection given under the skin, subcutaneous injection. Your healthcare provider will decide if you or your caregiver can inject DUPIXENT. Do not try to prepare and inject DUPIXENT until you or your caregiver have been trained by your healthcare provider. In children 12 years of age and older, it's recommended DUPIXENT be administered by or under supervision of an adult. In children under 12 years of age, DUPIXENT should be given by a caregiver. Please see accompanying full prescribing information, including patient information. Indications. DUPIXENT is a prescription medicine used to treat adults and children 6 years of age and older with moderate to severe atopic dermatitis, eczema, that is not well controlled with prescription therapies used on the skin, topical, or who cannot use topical therapies. DUPIXENT can be used with or without topical corticosteroids. It is not known if DUPIXENT is safe and effective in children with atopic dermatitis under 6 years of age. With other asthma medicines for the maintenance treatment of moderate to severe eosinophilic or oral steroid-dependent asthma in adults and children 6 years of age and older whose asthma is not controlled with their current asthma medicines. DUPIXENT helps prevent severe asthma attacks, exacerbations, and can improve your breathing. DUPIXENT may also help reduce the amount of oral corticosteroids you need while preventing severe asthma attacks and improving your breathing. DUPIXENT is not used to treat sudden breathing problems. It is not known if DUPIXENT is safe and effective in children with asthma under 6 years of age. With other medicines for the maintenance treatment of chronic rhinosinusitis with nasal polyposis in adults whose disease is not controlled. It is not known if DUPIXENT is safe and effective in children with chronic rhinosinusitis with nasal polyposis under 18 years of age.